A very pleasant good morning, ladies and gentlemen, and welcome to In the Streets Again with Claude Sinclair. I am your victim ambassador. Now today, ladies and gentlemen, I'm completely upset. Upset because we, again, tend to disrespect the people that provide excellent service, life-saving service. These are the people that we tend to disrespect from time to time. We disrespect our teachers. We disrespect our nurses. We disrespect our doctors. We disrespect our police officer. We disrespect our soldiers. We disrespect all the people that are in a position to help. We tend to treat these people very inhumanely. Now today, ladies and gentlemen, I'm talking about an incident that happened about 3 days ago. This happened at the Bustamante Children's Hospital. Workers at the Bustamante Hospital for Children who walked off the job yesterday to protest an incident in which one of their colleagues was seriously injured, threatened that they will not resume duties today unless security measures are implemented by the hospital's management team. Now, ladies and gentlemen, we're going to take a look at the intricacies of this case, and then I'll come back and talk to you about how I feel and how I think Jamaicans should treat these people, these very valuable, viable, important people. Let's take a look and listen here. Workers at the Bustamante Hospital for Children who walked off the job yesterday to protest an incident in which one of their colleagues was seriously injured, threatened that they will not resume duties today unless security measures are implemented by the hospital's management. About 11:30 on Wednesday night, splinter from a shattered glass window became lodged in the eye of a health records technician after a parent who reportedly wanted his child to be assisted at the hospital was told to wait, got upset and smashed the window. Consequently, the workers were incensed by the way in which the situation was handled and also by what they describe as continuous abuse from parents, took to the streets to register their disgust. The workers, which included all categories except doctors, gathered outside the gates of the St. Andrew Hospital singing and chanting, "We want justice, we want security, we're tired of the beating." Tamara Brown, a health records technician and union delegate from the Union of Technical Administrative and Supervisory Personnel, UTAPS, told the newspaper that the workers have reached the limit with the constant abuse from disgruntled parents and were spurred to protest after their colleague was injured. "We are here because our cup is full. We want better security system. We want the parents arrested and convicted, and we want back the police post that was here and was removed," she said. According to her, this is the third incident for the month in which a worker has been injured. Brown said in the other two incidents, a woman pushed the door and hit a doctor because she did not want to wait, and a man pulled a knife on another doctor after he was told to wait. She also said that parents have been issuing threats to workers. "This has to stop. This must stop. We want justice. We want Minister Christopher Tufton to step in," another worker said. At the same time, Shireen Ross, another health records technician, said that despite the complaints from workers about the ongoing abuse from parents, all they have received from the hospital's management are empty promises. Negotiating officer for UTAS, Howard Litchmore, who was present during yesterday's protest, said that he had met with the hospital administrators and that they have agreed to put in certain measures, including installing windows that cannot be shattered, increasing security, and placing security at strategic points. But the workers are not convinced. They believe nothing will be done and accuse the management of making empty promises whenever an incident arises. "Our return is dependent on solid measures, not fairy tale," Brown said. Measures like us hearing from Minister Tufton saying that on this day this will happen, or on that day we will have a security post. They need to change the security company that is here because the company is not effective. "We can't be working and security is sleeping," she added. Their workers' actions yesterday prompted the Southeast Regional Health Authority, SERHA, to advise the public that the Bustamante Hospital for Children will only be accepting emergency cases until further notice. In a release yesterday, SIR said it is working with the staff to restore normality as soon as possible. Wow. Ladies and gentlemen, can you imagine? The Bustamante Hospital for Children is under siege. Under siege because we have parents who are very selfish. We understand if there's an emergency and your child needs immediate care. So does all the other children that are there in the emergency area. All of them need emergency care. You must have a number 1. You must have a number 2. You must have a number 3. You must have a number 4. You must have a number system where they look at the case, look at the severity of the case, and take it case by case. But you, as a parent, cannot just barge into the hospital and because your child, and I understand the pain that you're feeling, you know, you want attention for your child. But think about the other parents who have been waiting there, some all day into night, some all night, some injuries more serious than some more life-threatening than some. So we have to look at all these things. Parents, how can you go there and further disrupt the treatment of other kids that need these nurses? Right now, you see what is happening? Emergency care only. Can you detect whether your child is suffering from a real emergency or not? No. These are the people who are in a position to help you. These are the people that you should respect. These are the people that you should honor. A doctor and a nurse is very, very important. These are life-saving people. How can you disrespect them? So, Honorable Minister, this one is very, very easy. All you have to do is implement the right security procedures and technique and make sure that the patients who come there respect these workers, honor them, and wait their turn. These doctors and nurses are so trained that they can look at this case and they can say, well, this one is more severe than that one, and they can just follow suit. We don't have to go there bullying these doctors and bullying these nurses and bullying these record technicians, because all of them work together to make sure that they provide proper service for you as citizens. Recently, a doctor was murdered. How can you kill a doctor? How can you murder a doctor? How can you take the life of someone who's in such a position that one day they can help you? Recently, there was this WhatsApp video that was floating around. I don't know if some of you have not seen this video. It's a video of a man driving a white BMW. He was a very cocky man. And while he was driving, he somehow blocked the path of an ambulance. Now, would this stupid driver move? Hell no. He held up the ambulance and he came out of the car and he called the police, even though the ambulance driver told him many times that he's going on an emergency. You know what this irate driver did? He even peeked into the ambulance. And when he peeked into the ambulance and he didn't see a patient, he was even more irate, blocking the path of the ambulance. Anyway, after 10, 15, 20 minutes later, the police came and of course, they sided with the motorist and the ambulance had to wait. Ladies and gentlemen, would you believe 5 minutes later, just after the father reaches home and found out that his son was dying and desperately needed an ambulance, guess what? He saw the same ambulance driver driving into his yard. And just to say, ladies and gentlemen, his son passed away because of his own parents' stupidity. Respect our doctors, respect our nurse, respect all the staff, even down to the janitor that cleans the hospital. Respect them, because these are the people that are in a position to help. Jamaica, let's clean up this mess. Let's speak to those people who are, to me, who have lost it. To those who are sane, pull the ones that are going insane and deal with the situation. Because of course we cannot afford to have our emergency. Alright, thank you very much for watching. Have a great day.